Hi everyone, and thank you for joining me here today. With the release of the first vaccine, many of us have questions. When is it available? What should we expect when we get it? Are there any side effects? Do we still have to wear these masks? Can we still give COVID to our loved ones after we receive the shot? We have those answers from one of Cleveland's best heart doctors on the front lines with the Cleveland Clinic. Also, we joined my brother for a great chicken on the grill recipe that you don't want to miss. But first, let's meet Dr. Raul Schwartzman, staff cardiologist at the Cleveland Clinic and member of the non-for-profit Cover or COVID. All right, so today we bring you the latest information on COVID-19 from the front lines. Dr. Raul Schwartzman is a specialist in cardiovascular medicine from the Cleveland Clinic here in Ohio. Welcome, doctor.
Thank you for having me. How are you?
Thank you. Thank you for everything that you do. So you are treating now people that have COVID. Tell us a little bit about that.
Well, in cardiology, we see quite a few of them. Not directly because it's not the first concern when they come to the hospital, mostly respiratory issues, infection, fever, etc. But there are two main reasons by which we see them. One is that if they have pre-existing cardiac issues, can get worse because of the infection with COVID, or COVID itself can cause cardiac issues. So that's why we're seeing patients. There's been quite a ride since March, April with these peaks after the particular holidays, etc. Right. So when we need people help each other to avoid that from happening again.
I've already heard from both some of my Latino friends and non-Latino friends that some of them didn't feel comfortable getting the vaccine because of they're just not sure if it was going to be okay, you know, for their health. What do you have to say to those folks that saying they don't want to?
Fortunately, is not the case. They are we know is extremely safe. It's true. We cannot talk about long-standing or long-term side effects if they show up because there's nothing we know. This condition, as a condition, started a year and 5 days ago in China. And therefore is nothing we know long term. But this should not have any doubt that all the processes followed to develop vaccines have been absolutely standard, be much faster because there was just a joint venture between governments, between private investments and scientists. But it's nothing that will make you think that they cut corners. And when you see well-known authorities in science like Dr. Fauci backing up the vaccine, be certain that there is no political interest behind that, is not to get some votes, is not to make government happy. This is absolutely true that vaccines are safe. Do they lack all kinds of side effects? Of course not. Vaccines can have side effects. But as we spoke before, every intervention we have has risks and has benefits. Definitely for the older folks, those who have pre-existing conditions, those who are exposed to the virus, the benefit is much, much, much larger than the potential risks of the vaccine.
And you just got the vaccine not too long ago, and how are you doing?
Great, like nothing. I didn't even notice it, and I have not even local pain, nothing, just absolutely nothing.
That's wonderful.
Again, the vaccine will not be the end of the pandemic, will be the beginning of the end, but we need to ensure that everybody, most people has it, and work on the hesitancy on receiving it. And just not vaccines, talking about also masks or social distancing or washing hands. Because the message has been so mixed that people do not know who to believe or what to believe.
So when you get the vaccine, can you still spread it?
Apparently, yes. The fact that the vaccine is given intramuscular and the spread is basically from mouth and nose, apparently there is still a possibility of having viruses there, and so you can spread it. That's why it's an excellent question, and that's why people should not relax after the vaccine, say I'm done, and now I can do travel, do whatever, because for themselves, it is possible that if, and that's what the vaccine does, to reduce the chances of having serious disease, not to avoid COVID altogether, it's just to reduce the seriousness of a disease that puts you in the hospital requiring ventilator. But you are still a vehicle to transmit the disease. And that's why the concept of solidarity and thinking of each other is crucial. It's crucial. So you should continue wearing a mask, because even vaccinated, if my nose has the virus, every time I talk to you, close to you, I sneeze, I cough, that can get you the virus. And if you, for reasons that because you are not the first line worker, you are not there yet, or you are because you are a young woman with no conditions, you'll be not there in the priority groups, I have to protect you. Otherwise, it would be a very selfish act. Having the vaccine for me, not wearing a mask, and spreading viruses right and left.
Mm-hmm. So we're not passing judgment, I guess, on anyone, but this is just a fact. We know people, I'm sure you do as well, Doctor, I do, that, you know, smart, intelligent people are not following the CDC guidelines. Some of them don't want to wear masks. Some of them want to go hang out with people that are not in their bubble and their home, you know, live with them. Why do you think that is happening?
Well, we have probably redefined what is called smart people, but we probably, one thing is the individual intelligence, and the other one is the community or the social intelligence or the solidarity. Here there is a very is inbred in the psyche of the American, the fact that my freedom cannot be touched. So I can carry a gun because I want to carry a gun. I don't need a mask because it blocks the air I breathe. I want my face to be seen, and you're nobody to tell me what to do with my freedom. And that's a problem. And that's a problem, and it's not even true, because the same person that thinks on that line, when it reaches is on a line to a restaurant, follows the line to the restaurant. If you made a reservation before me, I will sit after you. They don't push you or elbow your eye because they are there. They respect that. So why not to respect this? My rights end when yours start. And that line is something that the government clearly failed to show when they just telling people to participate in demonstrations against masks or against Fauci, or showing that masks are not important. And 2 weeks later, you realize there was a super spreader event related to that. Clearly shown once and again. It's not just once, you see it all the time. So we have to distinguish intelligence for oneself and as a community.
Right. And I think, do you think it's also misinformation? Because I've also heard people say to me, oh yeah, I went to go see my friend and everything's fine. You know, I had a mask. So there's like this.
It's absolute misinformation. But you see in medicine, and things are more less relevant, less deathly. Like patients say they had a conversation with the hairdresser who told you take these vitamins because they will be good for you. And they have to, well, listen, they will not kill you, but they're not beneficial. There's no proven benefit. When they were tested, rigorous manner showed no benefit. So it's pretty much throw into the lake. It's pretty much the same effect, but that's a vitamin. When situations like this, they get also information from social media, from the hairdresser, from, with all the respect of a hairdresser, but I don't talk about haircut styles because it's not my profession, let alone they should be talking about what the vaccine. So then the problem with it was one piece of information I recently read that is incredible, that in the last 2 years, the amount of information distributed in the world is more than the previous years in history.
Wow.
In 2 years, the information that was shared in the world is about what is in previous history. So that is analysis based on social media information, called big data or cultural intelligence. Mm-hmm. Now, who filters that information? who's the curator of information. So we have very, very limited sources of reliable information, and that's a problem. Did you know that 60% of the nurses at long-term care facilities in Ohio, 60% refused to have the vaccine? That was Michael DeWine's, the governor, report last Wednesday.
Oh, yeah, I heard that.
60%, and they are healthcare workers and nursing homes, which are the highest hit by the pandemic. So imagine. So we are failing. I feel responsible for that because we are the ones who have to convey the message, but some people have more press saying fake news than one that can tell you the truth. It's not easy.
So your message today is take care of each other, wear your mask, try to stay in your bubble as much as you can.
And create trust that was not built, or if it was, I didn't see it, but it's gone. And that trust, unfortunately, does not come from the government. The trust, if you look at a recent survey by Unidos US and other groups, showed that 50% of Latinos trust Fauci. 34 of them do not want to have a vaccine, not even close to their arms. So that's something that has to be built. So what is that trust? So, and who has, what do they have trust? They feel closer to what we call these influencers, people who are from the community and they talk to the community. So somebody can listen to LeBron James more than they listen to Fauci. Now, who knows more about vaccines? It's a stupid question. Nevertheless, it will be much more convincing if LeBron shows himself getting the vaccine than if Fauci shows the vaccine. They will say, so what? But this is the thing. So we have to go outside the scientific and politics world to look for these influencers, people who the community trust. There is no political bias. There's no interest on them to promote the vaccine. And people saying there that Bill Gates does it to get money. That's beyond false. So, but this is what we are working. We've been doing this with my group. We have one of the actors at Real Housewives of Beverly Hills, Mauricio Mansky, who worked with us on this, creating videos, telling people why masks are important and vaccines. Aaron Sanchez, one of the chefs at the Food Network, or Jose Calderon, NBA player, likewise.
Wow, Dr. Raul Schwartzman, you are a wealth of information. Thank you so much for your service. We will never be able to repay what you've been doing, and your staff and your colleagues are doing during this time.
You are able to repay just conveying the message of solidarity and taking care of each other. That would feel more than paid, believe me.
We will do that for you. Thank you so much.
We will.
Okay, so the doctor said we still have to wear our mask even after we are vaccinated. The vaccine decreases the severity of the symptoms, but we can still give the virus to someone else. And let's just really take care of each other. CoverOrCovid.org is creating a movement of solidarity to survive the pandemic together. On their website, it says, "My mask protects you, your mask protects me, and we are fighting the virus together." And now we go to our food segment. July loves food. Julio gives us the secrets of juicy chicken on the grill.
I'm about to cook 2 whole chickens on the smoker, on the Traeger smoker. One's gonna be a lemon pepper and the other one's gonna be a barbecue rub.
Here I baste the meat with adobo. Almost every meat I use this as a standard before I put anything else on it. Here I'm adding the lemon pepper generously on both sides, all around. Next I'll add the barbecue rub on both sides again, all around. I will add these to the smoker with the temperature at 350 for about an hour and 15 minutes. We got the internal temp to 170, so we're good to go. These chickens are real juicy and tender, as you can see. About half hour, 15 minutes, and I cut it up. I'm gonna let these sit before I cut them up. I actually haven't used my oven since May 1st, since I got the Traeger. Now you know why. Pretty good. These were some of the juiciest chickens I've ever had. They taste great. Better than most restaurants.
Okay, so it was Julio's birthday yesterday. Happy birthday to a great cook and a wonderful brother. Thanks, Julio. I'm sending you a virtual hug. Miss you guys. Thank you for being with us today. I'm Ana Garcia with The Ana Show, changing your world for good. This show is brought to you by our friends and partners at the Urban Community School, Coleman Spawn Corporation, and Don Tequila in Canton. Have a great week, everybody. Vaya con Dios.
Welcome to Don Tequila in Canton.
For a great family outing and daily specials that can't be beat, come to Don Tequila in Canton, now open with social distancing. We offer a huge menu of authentic Mexican dishes like the crazy pineapple, burritos, seafood, margaritas, a full-service bar, and a friendly staff with great service. Come January 22nd to our big fiesta celebrating our 4-year anniversary. Free entertainment starting at 6 p.m., a mariachi band to celebrate. And if you mention the Ana Show in Canton, you will get 10% off your bill. Mention the Ana Show. Curbside pickup is always an option with delicious drinks to go.